10 now. We're just going to go through boarding control, get our suitcases, and then go find the guy who's going to take us over to the clinic. We've got our first consultation with the doctor. He's going to do like another like a first-hand examination of the whole nipples and everything, and then he's going to give the all clear if we can go with the operation or whatever. We'll just see what he says. But anyway, like I said, let's get moving and catch you guys on the flip side. So legit, everyone else is gone, and there's mine. Last one, typical. Right, so we just arrived at our apartment, which is literally just behind us back there. But there's a change of plans. Earlier on I said that we was going to the clinic straight away to get the consultation and the hands-on assessment done, but that's actually now to tomorrow. So we're literally just going to walk around, try and find our bearings for the time being. We're going to try and find a grocery shop, supermarket, or whatever it is they call it out here, and then stock up on some food, because we booked an Airbnb, so like I can actually have a fully functional kitchen, so we can actually prep and cook some food while we're out here. So there's no excuses why we can't stay on track with our diets and everything. And like I said, we're just going to find somewhere to hang out, because we've got like 3-4 hours until we can actually book into our apartment. So yeah, wish us luck over here in Poland. No offense, but we don't know what we're doing. So literally just after 5 minutes of exploring Poland, I've come across this place, McFit, which I'm assuming is some sort of gym, or I could be wrong. Yep. Right, so we found a gym. That's that located. So it's like we've just found some secret gym, which is like underground, proper underground. Wow. That's insane.
Wow. Is it good?
They got all around my beard.
No, you're right.
That's nice. 9 out of 10 for the bagels in the Poland.
9 out of 10.
Yeah.
Scoring high.
Plus I'm hungry. Oh wow. Hello. Alright, so we finally got into the apartment. It's 3:15. My clock's behind. So yeah, 3:15, we just got into the apartment. Literally just been walking around like nearby areas, seeing what's around, just really getting our bearings. But anyway, back at the apartment, we've done some like grocery shopping, picked up on some main bits and pieces that's going to last me for the week. So typical stuff. Got some chicken, 6 packs of those. I've got some sushi for later on. We found a local gym as well, which you guys saw earlier. So I've got my little pre-workout here. So I've got my 85% cocoa, and I'm going to have some oats with that. And then my protein source is going to probably be some eggs. We've got some minced beef, some brown rice and white rice. We've got some fibre, got to get those micronutrients in. Some potatoes, some bread, olive oil, and then a little bit of sauce to add some flavour to the meals. Unfortunately, they didn't have the less sugar, less salt version, but whatever, this will do. That's pretty much it. Like I say, we're at the apartment now. I'm going to get a meal in, which is going to be probably my pre-workout meal, and then we're going to shoot off down to that gym. We probably get some footage of my workout, but I'm going to do that in a separate video because otherwise this one will just go on forever and you don't want to be watching like an hour length video. So yeah, I'm going to wrap up here and I'll catch you guys in a little bit. Alright guys, so we're back in the apartment. Just wrapped up that session down at McFit. Like I said earlier on, I'll put that into a separate video, so that workout video will go up a little bit later, probably after this video. But yeah, back at home now. Just going to get some sushi in. This is like my last meal before the op because tomorrow I've got to do some blood tests. I've got to obviously be in a fasted state for the blood tests. So post-workout meal, I've got 2 lots of sushi. I think there's a total of like 20 rolls or something, maybe a bit more. That's going to be my post-workout meal. I've got my Gynecomastia and Maximize here. From Stromsports Nutrition. They always come with me just to make sure that those carbohydrates go to where they need to. But yeah, pretty much just to summarize with the whole operation, I spoke to the doctor and I asked about what filming can I do, what can't I do. They said pretty much no filming is allowed. So to give you a rundown of what's going on. Obviously tomorrow I've got the consultation, then a hands-on assessment. So they're obviously going to just analyze the whole nipple area, just check it, then they're either going to give the thumbs up or the thumbs down. That's why I need to do the blood test, just for like health, from a health perspective. They need to just make sure that I'm in a good position, obviously to sedate me, etc. So there's a possibility that tomorrow they might say that they can't do the operation, but I think all in all, everything's going to be okay, fingers crossed. But yeah, all I know is that it's known as a moon insertion, which they pretty much just slit underneath the nipple and pretty much just remove all the scar tissue and the glands as well. That's the main reason why I come out here to Poland, because back at home privately they remove any scar tissue but they don't remove the glands, so I'm still susceptible to getting it back, which is just completely irrelevant and pointless. So that's why we've flown out here to Poland, and obviously they're specialised in gynecomastia surgery. So I know that I'm in good hands. What I'm going to do is, like I said, because I can't film anything in the actual clinic, I've got some pictures that you've probably seen on Instagram, so there's no point me getting naked now and showing you my nipples and everything. It sounds just completely weird. Why does anybody want to see my nipples? But what I will do is, I'm not going to wrap up this video right now, but after the surgery I'll get some footage so you guys can see like the scars and where they inserted and where they done whatever they had to do, and then I might post up like a picture next to it so you can see like the comparison. So yeah, that's pretty much it. I'm just gonna dig into my sushi now, get into the shower, go to bed, and that's me done. So see you guys in a little bit. So hey guys, post-operation update for you lot. To wrap up this video, today it's the 3rd of April, which makes it 2 weeks and 1 day post-operation. Now obviously, unfortunately, I was unable to wrap up the video while I was still out in Poland, just simply due to the fact that I was in a lot of discomfort and a lot of pain. They put me on tramadol, so I was pretty knocked out and didn't really know where I was and what I was doing. I couldn't think straight, so I didn't think it was best to update you guys on the whole surgery while I was still out there and while I was on the tramadol. I wanted to make sure that I was in a better frame of mind, I was in less pain, and that way I was able to answer all questions as best as I can, without leaving anything out. Obviously, because the main purpose of this video is for those individuals that are watching this and who are either having their gyno surgery done soon or are potentially considering getting their surgery done, and they have any concerns or questions regarding, you know, expectations, you know, wanting to know experience from the surgery, what happens during, what happens afterwards, how do you feel, what can you do, what can't you do. And like I said, I personally don't feel like there's much content out there discussing these variables and these factors, and obviously this is something that's massively common in bodybuilding lately. Obviously not with everybody, but there are still people out there who do experience gyno issues, some worse than others. So hopefully this video is, you know, valuable to many people out there. I personally think it's going to be. I think it's going to be informative. I think it's going to be educational, and it's going to be, more than anything, just reassuring that, you know, they understand what is expected and what they are going to be going through when they go through their gyno surgery. So yeah, coming back from that little tangent, update on everything that happened, starting with obviously the day of the surgery. The day of the surgery, we had a second consultation with a doctor. That was a brief discussion about PEDs that I was using, my PED history, how long I've been using PEDs, dosages, my rationale behind using PEDs, and what I would like to do in the future in regards to using PEDs. Obviously, they gave me the pep talk about that I should not use PEDs after the operation. That's just a standard procedure for them to do that. After that consultation, the doctor then introduced me to the actual surgeon that was performing the surgery. His name was Dr. Washes. He was a really nice guy. He, like I said, he introduced himself, and he done a hands-on assessment and just discussed about what he felt was going to be the best procedure going forward with the operation. What was the best actions to take place. So from the visual and hands-on assessment, he then decided that the left side didn't need any liposuction at all. There wasn't a great deal of abdos tissue build-up, so there was no liposuction needed there, which is obviously great news because that meant less scarring. The right side, however, there was a significant amount of abdos tissue. So that meant that there was lipo needed on the right side. But again, the scarring was so minute. It's barely visible at all. But obviously, although I knew that I was in great hands, in the back of my mind, and I think this is generally with anybody going into any kind of surgery, they're always going to be concerned and think of the worst case scenario. And the worst case scenario was that I woke up and the operation wasn't a success, or the scarring was horrendous and it was very apparent that it, you know, potentially could jeopardize my bodybuilding career. I think this is one of the main concerns and questions a lot of people have, and I can 100% recommend this clinic and Dr. Washes, because the actual job that he done is amazing. It's unreal. It was so clean, it was so tidy. The scarring is barely visible. I am going to show some pictures, so bear with me, but the scarring is barely visible. So tremendous credit to the doctor. Unfortunately, he probably will never see this video, but if he does, or if you are watching this, you know, I massively appreciate what you have done. I'm very happy and pleased with the outcome. So yeah, where was I? So he done the assessment. There was no liposuction needed on the left side, just the glandular tissue needed to remove him from the left side, and the right side, the glandular tissue and some liposuction. Now with the glandular tissue removement, what they do, and I was correct in saying that they do a moon insertion. So practically what they do is they do a 3 o'clock to 9 o'clock insertion. So they start from 3 o'clock and then go around to 9 o'clock, and it's literally just on the edge of the areola, which is the dark part of the nipple. So right at the bottom, they do a 3 to 9 o'clock insertion. From there, that's where they open up and they remove any glandular tissue. The liposuction on the right side is just below the actual areola, but again, the scar is so minute, you can't see it at all. They remove the glandular tissue. Now another question obviously that's asked often is, do they remove the entire glands. Now obviously their objective is to remove all the glands completely, but after I discussed this with the surgeon, he said it's not possible that they can remove every single bit of the gland. They said obviously from a macroscopic perspective they can remove everything they can see, but from a microscopic perspective they can't tear apart what is glandular tissue and what's like fat tissue and other things. So they remove, let's just say they remove pretty much 95% of the glands, which is obviously better than anything else. And another thing that was quite interesting for me, I thought was really interesting, was my perspective of the glands was that from what we can see is like the whole of the gland. So I'm going to use my phone as an example. So I thought from as you're looking at the nipples, say this had been the nipple, I thought the gland would be this to here, so from one end of the phone to the other end of the phone. However, what we actually see, what's protruding, is this part. So the gland from here to here, but the gland can actually come back and go into the actual chest, so go further into your body. And some people's glands can be the size of a fist or even the size of a phone. Obviously this is what the surgeon was telling me. He said that some of his patients that he's worked on, they had gland tissues bigger than his phone. Some were like the size of his fist. So what we can see is just like a tiny bit, but that tiny bit that we can see is like just the tip. Another perspective is like the pen. Like what we see is literally just that point. We don't see it like that, but that's sometimes how big the gland tissue can be. Mine in total, the left side, obviously I was very interested and I wanted to know how big mine was. My left side was 7 centimeters and my right side was 11 centimeters. So that puts in perspective on how big my glandular tissue was. Now, one of the main things that I wanted to bring up, which I've noticed nobody else has ever brought up, and I thought this was probably the most difficult part to endure out of the whole thing, and that was after the surgery I had to stay overnight at the clinic, and for 24 hours after the surgery I was unable to drink or eat anything at all. Now I said I wanted to bring that up because nobody else has ever brought that up, and the people that I was questioning about their surgery, they never mentioned this, and I think it definitely needs to be mentioned because it was freaking painful, man. To go 24 hours with no food or no drink at all, that was difficult. The reason behind this is obviously because going under general anaesthetics, there are potential risk factors such as blood clots, pulmonary embolism, which is blood clots in the liver, heart failure, strokes, excessive bleeding. So just for the 24 hours after the surgery, I'm not allowed to consume any food or drink any water. After a period of time, I was allowed to sip on water, and then eventually I was allowed coffee, and then lastly I was allowed a bit of toast. But again, that was probably about 36 hours total after the operation. So yeah, that was quite painful. So for any of you that are getting their surgery, bear that in mind, that you will have to undergo 24 hours with no food or water. So after the 24 hours, the doctor and surgeon saw me again for one final time. They gave me the all clear to be able to leave the clinic. I still had 3 days left in Poland. So what they'd done, and I thought this was really nice of them, the service was absolutely exceptional. It was exceptional service from the clinic. But what they advised was that every morning I came back so they could check up on me. They would check my blood pressure, and they would also redress the dressing, which I thought, again, like I said, was really nice of them. They didn't have to do that, but they did. So yeah, I went home on the Wednesday morning. I went back on the Thursday for my dressing. They done a checkup, and then I went back again on the Friday for another checkup, which was my last checkup because I flew out on Saturday early hours in the morning. So yeah, they was really happy. There was no swelling, there was no concerns. Everything was a massive success. They obviously just gave me some medication, some tramadol and some strong paracetamol. and then they just gave me the antibacterial, anti-infection cream that I had to apply onto my nipples twice every single day for 2 weeks. That was pretty much it. And then obviously I'm back in London on Saturday. Oh yeah, the only other thing was the compression garment. Now, they advise you to purchase the compression garment, and I also definitely advise anybody who is getting their surgery to purchase the compression garment. Now, what this does is this helps speed up the recovery of the whole surgery, and it's practically just a vest that you wear, and it's just like, it is what it is. It's a compression vest, and it holds everything in place. It helps with rapid blood circulation to the area, and also what we have to remember is when they remove the gland tissue, it leaves a massive hole. So now what happens is there's a gap between the areola, the nipple, the skin, and then the muscles and all the other tissue within inside the actual chest. So what we need to do is we need to kind of fill that gap. So with the compression garment, what that does is that compacts everything together, and it compresses it all together, and then it allows naturally your body to reattach the nipple to the new tissue. So that's the purpose behind the compression garment, and again, like I said, just to speed up the recovery. So I definitely recommend anybody who is getting their surgery done, don't scrimp on the compression garment. It's 60 to 80 pounds, but it's well worth the investment, and it just speeds up the recovery. So if you are somebody who's training, you're a bodybuilder, you can get back to training before you know it. So yeah, like I said, after the operation, when I got back to England, I spent another week pretty much doing nothing. I wasn't able to do much. My mobility wasn't great, so obviously I needed a lot of assistance and a lot of help from family members and my partner, which obviously I massively appreciate all their help and support. I wouldn't be able to do a great deal during that time without them. Obviously one problem was I lost a significant amount of weight, because a couple days before I flew out to Poland, I dropped out all anabolics. So I'd went 2 odd weeks without anything in my system. Well, there was still stuff in my system, but I hadn't injected anything in 2 weeks. So there was some water retention that was lost, and obviously appetite, because where I wasn't training and I wasn't as active and productive as I normally am on a day-to-day basis, I just simply wasn't eating as much food. So I dropped a total, I think, of 8 or 9 pounds. Obviously most of that's going to be just glycogen and water retention. So yeah, like I said, now until the end of May, the goal is just active recovery and recomping before I start my competition, so my contest prep. Again, what this does is this allows ample time for recovery, so that way going into the contest prep, I don't interfere or interrupt any of the scarring or the healing process, because obviously what we have to remember is that although the scar on the outside might be very, very small and may heal within 2 to 4 weeks, the internal scar, the doctor said, can take up to 2 years to heal. So just because what you can see visually is just a very small scar, and it looks like everything's healed up and you're back to normal, don't be misconstrued by what's going on internally. You know, there's a lot of scarring internally, there's a lot of inflammation going on internally, and that can take a very, very long time to fully recover from. So that's why I wanted to give myself an additional 2 months to make sure everything was absolutely perfect, and that I was in the best position going into my contest prep. Because if I delve straight into the contest prep now, obviously I've dropped 10 pounds already, my strength is crap, I'd have to try and pick up my appetite again. I'm just not in the best position going into a contest prep. Now in regards to obviously the pictures, I know that's the most important thing that everybody is waiting for. I will post up now some pictures, and what I'll do is I'll post up some pictures of me at my worst. So when it was most apparent, when you could really see the gyno. That will be when I was stepping on stage in 2017 at the UK BFF Kent Classic. I'll post up that picture, it might be up on your screen now. I'll post up a picture the night before the operation, and then the pictures post-operation, so you can see some of the stages. And that's pretty much it. So again, like I said, I hope you enjoyed this video. Hope that answered any questions at all. If there's anything else that you want me to answer, shoot me over a message. There'll be more content coming out soon. Like I said, in 2 months' time, I begin my contest prep, which I'll document as much as I can of that contest prep. So yeah, other than that, guys, I hope you did enjoy this video. If you are new around here, make sure to subscribe to the YouTube channel, like the video, and I will see you on the next one.